Hi there, and welcome to Lesson 5.2, Treatment Planning. I've got an excellent lesson lined up for us today because we are going to examine how treatment planning is one of the most significant skills that you will learn in healthcare management. As there are so many things that you can do with being able to treatment plan, like being able to better communicate and explain your specific and relevant needs, create the most customized and individualized treatment and therapy, and become a more relevant advocate in your care. This video may go a little fast, so if you haven't done so already, have the presentation notes in front of you. And be sure to watch the video all the way through for the first time, and then go back to the parts that you need more clarity on. And after this lesson, you will have the best tips and tools to further your relationship with your provider as an equal partner in care through treatment planning. And your key takeaways from this lesson is to be a more active member on your healthcare team, be able to identify what you can do to contribute to your care plan more, as well as understand the universal formula to treatment planning. So let's first get started by understanding what a treatment plan is.
A treatment plan is a detailed report for the prevention, maintenance, or recovery with information about a condition or occurrence. The goal of treatment planning is to help you have the best possible experience throughout your health occurrence and project compliance issues. A well-executed treatment plan will be cost-effective, include expected time length, and the overall expenses of the condition. It is important for you to plan in medicine just as it is important for you to tackle any task in life. Just like you wouldn't leave the house without a plan for a babysitter to come help take care of your children, refer to the instructions when putting together a piece of furniture, or having a blueprint to build a home. It is just as important for you and your doctor to create a treatment plan for your health. Many physicians pride themselves on their ability to create treatment plans. They and their cohorts know that treatment plans work by the outcome success of their patient. However, a lot more research and development goes into their skill in which they present. So helping the physician treatment plan is the most important, impactful, and significant task that you can do as a patient. Your ability to treatment plan strengthens your relationship with your professionals. So in this video, we're going to examine where to begin treatment planning, apply the S.M.A.R.T criteria to the treatment plan, and take a closer look at the elements of a treatment plan. When you properly treatment plan, you are adding value to your healthcare team as a patient. Today, for a patient to properly treatment plan, it takes more analytical skills than just following doctor's recommendations. To begin, you'll want to identify your goals and ask yourself, what do you want to accomplish out of treatment? Next, define your tasks. Develop a team to do so. You will need things like drivers, preparers of meals who will clean the house so that you can properly focus on the plan. Next, organize the details based on the defined tasks. These tasks can be modified based on your S.I.P tool. So go back to 3.1 and look at your patient perspective, or I have a link provided below. Next is the most satisfying step in your plan, which is to execute your vision and create a completion date. And the last step, your final reward, is for you and your physician to measure your outcome. Of course, this takes a little bit of balancing, but you can better plan your steps by using the S.M.A.R.T criteria. It is a good idea to formulate your treatment plan using the S.M.A.R.T criteria. Be specific about your condition, use exact wording about your health issue, and apply chief complaints and re-examine the duration, location, and severity of your illness. Make your plan measurable from the already established information about your health condition. Create incremental measurements of your status and how they relate to your goals. Good measurements could also be seen as a list of milestones. Make your treatment plan attainable, which is a realistic goal in how you intend to achieve it. Assignments could be made by challenging yourself without causing stress or injury. Make sure that your plan is relevant and realistic to fit into your lifestyle. And whether your plan can be achieved or not should be brought to the doctor's attention as soon as possible. And the last step into treatment planning is to make it time-bound. If you feel that your provider's treatment plan is realistic and achievable, then the next step is to make it time sensitive. The elements of a good treatment plan should consist of your experience, your budgeted costs, and your outcome. Each treatment plan is time sensitive and have an ultimate goal. You may have multiple treatment plans throughout one health occurrence. Your experience should be based on scheduled appointments, your recovery time, and how many people are involved in your at-home care. The next element to factor in are the healthcare costs, which include the direct, indirect, out-of-pocket, and the insurer's assistance. And with your chosen plan, write out a list of pros and cons. Some pros could be whether it's convenient, whether you have professional familiarity with the professional, or whether you like the technology being used for the procedure. Some of the cons could be the time that it takes to heal, the money factor, or the lack of family participation. So with this treatment plan's formula, you can easily calculate your experience, the costs, pros and cons, or I have created a treatment plan calculator for you to follow. The link is below.
And that concludes our video for today. Please join me in our next lesson, in which we will take our newly developed life skills in treatment planning and learn how we can get the best possible outcomes from them.